Hi, good morning. Thanks for joining me today. I'm very excited to be presenting information to you about insomnia and the role that medical cannabis can play in the treatment of this disorder. As a disclaimer before we begin, I just want to note that this presentation is for educational purposes only, and it is not meant to diagnose or offer medical advice for your unique condition. Please always consult your medical provider or team before beginning a new therapy. Oh, let's go. Quick introduction about me. My name is Noelle Potash. I have a master's in acupuncture from the Colorado School of Traditional Chinese Medicine, also known as CCMU now. And for those of you unfamiliar with the acupuncture profession, we are not only trained in Eastern medicine and techniques, which of course is our main focus, but we also have to have a very deep understanding of Western biomedicine in order to practice safely and effectively. So the majority of this presentation is Western biomedicine focused, but perhaps in the future we can have a conversation about how cannabis is perceived through the lens of Chinese medicine. I also have a doctorate of acupuncture with a focus on integrative health and evidence-based medicine from the Pacific College of Health and Science. And I have had the pleasure to do a 2 years of herbal Chinese herbal mentorship. The first year with Dr. Christine Cannon in 2020, and then a second year of mentorship with Dr. Stephen Wong in 2022, which laid the foundation for what will be my lifelong study of Chinese herbal medicine. This is what led me to my interest in cannabis as a medicine because it was used in classical Chinese herbalism, and we are seeing a resurgence these days in its use. I wanted to know exactly how cannabis is affecting my patients, how it's benefiting them, is it causing them any imbalance or harm, how can I use it in my herbal practice, which led me to where I am currently. I'm 2 classes away from getting my second master's in medical cannabis therapeutics, also from the Pacific College of Health and Science. So in the past, insomnia was classified as primary and secondary, which is no longer the case. Now, according to new diagnostic criteria, there is a recognition that insomnia is not just a symptom of other somatic, physical, or mental disorders. It's an entirely independent condition, and it deserves very specific consideration in practice. To be clinically diagnosed with insomnia, a person needs to have difficulty falling asleep, staying asleep, or waking up earlier than desired, resistance to going to bed on an appropriate schedule, or difficulty sleeping without a parent or a caregiver's intervention. In combination with this, a person would report one or more symptoms that accompany the sleeping issues, such as fatigue, concentration, problems, poor memory, impaired social, familial, or academic performance, mood disturbances, daytime sleepiness, behavioral problems like hyperactivity, maybe impulsivity or aggression, reduced motivation or energy. They may be prone to accidents as well. In addition to these symptoms, the disruption of sleep-wake cycles cannot be explained by a lack of time for sleep or a poor sleep environment. And these symptoms need to occur for 3 or more times a week, and for more than 3 months. They also cannot be explained by another sleep disorder such as apnea. Often insomnia presents in combination with other disorders such as chronic pain, substance abuse, mental disorders. And in these cases, to effectively treat the insomnia, you need to treat these other issues as well, so that the person may be facing any. Sorry, we need to treat the entire person, right? All the things that people are facing, and to bring balance to the body and support their healthy sleep-wake cycles. Sorry. Our endocannabinoid system, or ECS, is our homeostasis system. There's receptors for endocannabinoids all over the body. The main or most common receptors are CB1 and CB2. These are G-coupled protein receptors. And CB1 is located primarily in the brain and central nervous system, while CB2 receptors primarily are located in the periphery of the body and the immune system. When CB receptors are activated, they send signals in a reverse direction up their neuronal channels, and they either increase the release of inhibitory neurotransmitters or increase excitatory neurons. This keeps the body in balance. It helps us to adjust to external and internal stressors. It's almost like an environmental buffer system. Sometimes a bombardment of constant stressors can either rev up the ECS too much or overstimulate the receptors, leading to the ECS to kind of shut down and not take on any more endocannabinoid reception. It could also lead to endocannabinoid deficiency, and our bodies naturally make these endocannabinoids to activate these receptors so that we can have homeostasis in the body. So when you can obviously see that when there's too much, a constant influx of stress or a constant use or a constant influx of endocannabinoids without reception, it can lead to imbalances in our homeostasis, which can cause a myriad of problems. Our main endocannabinoids are 2-AG, 2-arachidonylglycerol, and AEA, or anandamide, as it's sometimes called. Cannabinoids from plants, specifically cannabis, also activate these receptors. THC from cannabis directly binds with the CB1 receptors, and other cannabinoids like CBD indirectly affect those receptors. When you're indirectly affecting these receptors, you're either inhibiting binding, or maybe you're causing chain reactions from other G protein receptor activation. You could be influencing serotonin receptors, which then influence CB1 receptors. TRP channels also affect our endocannabinoid system, and the inhibition and activation of enzymes that break down our endocannabinoids can affect how these receptors are activated. The endocannabinoid AEA has a natural circadian rhythm, with AEA peaking in the morning when we wake up, and the lowest reading is before sleep. AEA is responsible for our feelings of peace and connectedness. It's responsible for that feeling called a runner's high, and it's increased in response to meditation, exercise, especially aerobic exercise, and it's even increased in some foods like chocolate, which inhibit the breakdown of AEA in the body. CBD is also an inhibitor of the enzyme FAAH that breaks down AEA, which leads to increased levels of AEA in the body. Another trait of our circadian rhythms is the increase of GABA, which is an inhibitory neurotransmitter, before bed. So it's the neurotransmitter that's responsible for turning off all the lights in the house so that we're ready for sleep. CBD and THC also help to regulate our ECS by increasing GABA. Animal and human studies have demonstrated that THC is hypnogenic, sleep-inducing, and studies have also shown that sleep disruption is associated with cannabis use, especially during withdrawal. So there's some mixed information out there, which is normal because we are very complex human beings. We don't live in a laboratory. There's many variables around us. And also cannabis is what is called a dose-dependent drug. I'm missing the word right now. Biphasic. So in high doses, it does one thing. In low doses, it does another. CBD in low doses can lead you to feeling more wakeful and have excess energy, whereas CBD in high doses can make you feel groggy and sleepy, just like THC can lead you to feel anti-anxious in the morning, or anti-anxious when you have like a smaller dose, or you can feel more anxious and more paranoia with a higher dose. So it's not unique to cannabis's how cannabis works. We see this a lot in Chinese medicine as well, with herbs like chai hu, if you're familiar. A very large dose can help, expel a malarial type pathogen. Really gets rid of heat. It dredges the liver meridian. Whereas in small doses, it can help the function of the liver, help digestion. It's not really pushing out anything. Same thing. We see this with Fuling as well. Okay. So sleep and cannabis. Sleep phases are measured by EEG or ECOG. These are electroencephalograms or electrocorticograms. And these measure the brain activity during sleep, which breaks our sleep cycles into two main categories: REM, which is rapid eye movement, and SWS, slow wave sleep. This is important because this is how we get a lot of our measurements as to how effective um, insomnia treatments are in the research papers. And also, if you're taking a medication that reduces REM sleep, you're going to feel less rested in the morning. These are both cycles are very important to have a fulfilling sleep and to feel rejuvenated when you wake up. Um, THC, in many cases, in many models, research models, shows that it decreases the waking after sleep onset and increases your slow wave sleep, but sometimes it can decrease REM, or rapid eye movement sleep, which is not always the case. We'll see some research in a little while that actually shows it didn't affect REM sleep at all. So it's really dependent on dose, person, and many other factors. Many people report that help with sleep quality is the reason they reach for cannabis in the first place. Both in the research articles and when I see people in my clinic, this is the case. It's like the second most common reason people reach for it, aside from pain. However, much of the research shows that cannabis sleep inducing effects work on the short term. They're not long term sustainable. Chronic use of THC creates drug tolerance, and it can overstimulate the CB1 receptors with heavy use, which can actually lead to more endocannabinoid system imbalance and increase the need for a higher dose of cannabis to get the same effect. Because of the legality of cannabis, there's not very many human studies, unfortunately. Most of the things are done in vitro, which is in a petri dish, or in vivo on rats and animals, which doesn't always apply to our human physiology. Of the research available, though, there is strong evidence that cannabis can at least acutely help with sleep onset and duration. In one study conducted by Walsh et al., which is a 2-week study where they gave participants a mix of 20 milligrams THC, 1 milligram CBD, and 2 milligrams of CBN over a 2-week time, they found that the cannabis actually allowed their patients to increase their time staying asleep, decrease time spent awake each night. But one of the problems that they faced, or that they witnessed, is that in the second week of study, half of all the participants doubled their dose in order to get the same results. So that's a little bit worrisome. Another thing of interest from the study is that there was no observable changes to REM sleep, which has been found in other studies. This could be due to the fact that using THC in combination with other cannabinoids maybe got rid of some of the REM reducing effects. Not entirely sure, but this is what they observed. In another short 12-week study, cannabis was found to offer some same-day improvements in sleep quality in those who held their medical cannabis cards, and it also offered increasing improvements in insomnia symptoms over the 12-week period. It did not, however, offer same-day improvements in mood or pain disorders in these patients. The downfall of the study is that self-reporting can sometimes be subject to bias, especially if people are very pro-cannabis, which is just something to note. People with insomnia due to pain report more issues staying asleep rather than falling asleep. In another study, those who use cannabis for insomnia related to chronic pain reported less wakings during the night. However, there is a correlation that they found between more frequent use and an increase in problems staying asleep, which supports the theory that over time medical cannabis effects on insomnia decrease over time. CBD gets a lot of marketing, but it also has very weak evidence in treating insomnia on its own due to lack of studies. However, in a few studies available, CBD significantly helps patients improve sleep quality. Not only that, but it helps ease symptoms of insomnia and comorbidities like ADHD and anxiety. CBD was also shown to be effective in large doses when insomnia is due to REM sleep behavior disorder, frequent nightmares, or body restlessness. In a small case series that was done, this is where they found all the information. On top of that, CBD has also been shown to decrease the symptoms of cannabis withdrawal, which has the hallmark symptom of increasing insomnia. So CBD could potentially decrease insomnia from withdrawal. What I've seen in the clinic with some patients, not all, when waking is due to anxiety and a very overactive mind, CBD kind of quiets the mind and allows them to fall back to sleep easier. Um, it's not always the case. It just depends on the person. Okay, when using cannabis medicine, there's some things we have to be aware of in order to use cannabis safely and effectively, especially in the treatment of insomnia. Dysfunctional sleep is a key part of almost all human psychiatric disorders, including substance abuse disorders. So, almost all mental, emotional, psychiatric disorders um, have some component of insomnia within their symptomology. Not saying that all sleep disorders are correlated with mental health disorders, but many are. It is important to thoroughly examine a patient's mental health history before recommending cannabis as a medical therapy to avoid worsening a patient's mental health. This is because THC, especially, has potential to worsen or provoke the onset of certain psychiatric conditions, such as anxiety, depression, paranoia, and even schizophrenia. Many with PTSD also reach for cannabis to help with sleep issues, and PTSD patients are more likely to develop a cannabis use disorder as well. So, withdrawal from cannabis also leads to insomnia, which can keep a person using even when they wish to abstain from use. This can create dependence on the medicine or lead to the use of other substances. Cannabis withdrawal is the number one reason for relapse in those with cannabis use disorder, as I think I think the withdrawal is the number one reason for relapse in most use disorders. But in any case, in the study by Cola et al., they also found that cannabis use disorder led to an increase of alcohol and tobacco use as well. It should be noted that high doses of THC can worsen respiratory disorders that affect sleep, such as apnea, so caution should be taken with dosing and product choices. Also, not mentioned in the slide, cardiac disorders deserve their own presentation, but cannabis has a lot of potential to interfere and interact with those medications as well. And cannabis also decreases the metabolism rate of other drugs like sleep aids, anti anxiety medications, mood stabilizers, and, like I just said, cardiac meds. So it's, I say they're contraindicated, but that just means for most of sleep aids and stuff, yes, contraindicated. But with cardiac medicines, you just have to work really closely with your committed team, your cardiologist, um, and all other providers that you're seeing. Even if a patient is having substance use disorders or a psychiatric condition such as anxiety or depression, it doesn't mean cannabis is contraindicated for the treatment. It just means that you need to use more monitoring. Changes to mental health and substance use need to be looked at and monitored closely. For example, when you're choosing a product with little to no THC, um, that's going to be recommended for this group of people because, of course, the THC is what has the potential to increase or worsen um, these problems. Um, it's also always a good idea to start at the lowest possible dose and slowly work your way up to a dose that works for you and your patient. So, the lowest possible dose, slow titration, that's the way to go. And you stay at that dose where you're going to get the most effect with least amount of product. Another thing to consider very quickly is how you're going to use cannabis. To decide, we have to take some things into consideration, like how fast do you want the effects, how long do you want the effects to last, what comorbidities do you or your patient have, and of course, the price and what's legal in your area. For a quicker onset, inhalation is your best bet, with effects coming on in a matter of minutes. Method doesn't last long as other methods, but may require frequent dosing. Vaping at a low temperature is the best because it contains less harmful chemicals and it preserves the integrity of terpenes, which support many desired health outcomes. Obviously, if you have something like lung cancer or um, some type of COPD or something like this, inhalation probably isn't going to be the most ideal for you, and something else, another way of using cannabis, will benefit you best. An edible will have an onset of 30 minutes to 1.5 hours, depending on a person's metabolism, what they ate, and the effects can last for up to 8 hours. It should be noted that with edibles, THC will have a more potent effect. So it's always a good plan to test an edible at home when you have nowhere to go, when you're not going to drive anywhere. Um, Even if you've taken edibles before, if you're trying a new product, because of the way products are made, it's always a good idea to test a new product at home when you have nowhere to go. Edibles also have more potential to interact with other medications, and always be aware if you have children or pets around to keep your edibles in a safe place away, or I mean, all of your cannabis products. Keep them up and away from little mouths and hands. Always consult your medical team, especially if you're taking any mood stabilizing medications or cardiac medications. And please remember that cannabis is not safe to take with sleep inducing meds. Another way to take them is a cannabis tincture. Most cannabis tinctures are not true tinctures. A true tincture is made with alcohol or glycerin, but most of them are oils and they act more like edibles. A true tincture will have a rapid absorption through the membranes of your mouth with a quick onset of effects. The only downside is they taste a little bad. Other routes that we could use are transdermal, a topical, or a rectal. I don't recommend rectal for insomnia because it treats more locally in the colon with mild systemic effects. Transdermal patches offer rapid absorption and long lasting effects, but the price point is high. So you need to have a very healthy budget for those that route. Topical only treats local areas where it is applied. However, this could be very helpful if pain is the main reason for your insomnia. So keep that in mind. So, putting it all together, I've come to some conclusions about how to use cannabis for insomnia based on the data that I just presented and my clinical experience. Cannabis, whether it's purely CBD or a mix of phytocannabinoids, can definitely help people struggling with insomnia fall asleep and stay asleep. In the beginning phases of their condition, this is when it's going to be the most useful. This should not be a standalone treatment since the effects lessen over time and tolerance builds in the system. Also, a constant influx of phytocannabinoids to manually balance your ECS makes it harder for your body to maintain homeostasis with chronic use. Because of this, if somebody were to choose to use cannabis as a therapy for their insomnia, I'm going to highly recommend that it is combined with other therapies and lifestyle modifications. CBTI, which is a CBT therapy focused on insomnia, has been shown to be very effective at treating insomnia, and it works well alongside cannabis use as a joint therapy. Of course, acupuncture and Chinese herbal medicine, I'm always going to say, is going to help, but it really does help well with insomnia and getting to the root underlying cause of why it's happening, and while also bringing your body completely into homeostasis. Um, Then there's also other things you could do at home. There's a lot of things you could do at home. Focusing on your sleep hygiene is very important. No computers and stuff before bed. But also, getting in adequate exercise, meditation, something that brings you a lot of joy and calms your nervous system, such as creating art during the day, can help you regulate your ECS. Eating foods rich in omega-3 fatty acids, getting plenty of lean meats, root vegetables, leafy greens, while minimizing fried foods, sugars, alcohol, lots of excess preservatives. These can help to bring balance to your ECS, especially since new research is resurfacing, about how your ECS is not limited just to your nervous system. It's actually an endocannabinoid dome, which encompasses your microbiome, nervous system, and mental health. So, if you or someone you know is considering trying medical cannabis for insomnia symptoms, Please consult with the healthcare provider so that the herb can be tailored to your unique needs. I really hope that you got some value out of this presentation, even though I know it was short. But I look forward to sharing more with you in the future. If you have any questions, you're more than welcome to contact me through my website in the contact section at www.acu.com. It is my personal practice website, and it will send you to my email. If you would also like coaching on how to use cannabis for your unique health concerns, please contact a cannabis educated health practitioner near you, or I'm available for telehealth appointments as well. And you could just find me in that website. And here is a little list of references where I sourced a lot of that information. And I just want to thank you again for listening and taking the time to learn about insomnia and cannabis. Aloha.